Good day. Today we are going to discuss the Meditech changes. This changes will allow the ED-RNs to do group assessments when documenting on pre and post tenecteplase. The new assessments include a new group assessment for tenecteplase documentation, which is called pre and post tenecteplase. Once the ED provider places the order for TNK, the RN will need to add the group assessment to her interventions. In order to do this, you click on Interventions and then at the bottom of the screen, click Add. There will be a search box that comes up. Type PRE in that search box and you will see the two interventions listed below. There you can choose the pre-post tenecteplase to add to your intervention screen. Once this is added to your screen, you will see a listing of 5 different assessments. You will also see a new assessment, which is for thrombolytic adverse reaction. This needs to be documented at the same frequency as your neurological and vital assessments pre and post TNK. This again is just showing you, once you click Add and add that, you will then see up in your intervention list the pre-post tenecteplase added to your interventions. Here is a picture of the group assessments. You will see the 5 group assessments there. Vital signs, NIH stroke scale, ED neurological assessment, physician notification, and thrombolytic adverse reaction. Make sure you are documenting your vitals, neuro, and NIH no longer than 15 minutes before you give TNK. This is a DNV requirement and also a JACO requirement. In order to document on your group assessments, you'll start with vital signs and click on it. Once you click on it, it will open the screen. If you need to edit the date and time, do so at this time. Go ahead and put all your vitals in, then click Go To, and that will bring you back to the intervention choices. Choose the next item to document on it, and then click Go To, and keep going until you have used all of the assessments that you need to document on, and then you can click Save. When you are ready to enter the next set of data assessment, you will highlight pre and post tenecteplase again, choose Document, your 5 intervention choices will appear, and then you will be able to choose the intervention that you are going to document on. In this case, we chose vital signs. Once the intervention opens, before you hit anything on that page, go down at the bottom is Recall Values. Click on Recall Values, and it will recall certain values that may remain the same through your documentation. Once you start documenting in the page, you cannot recall values, so be sure to do this first. In this example, the pulse occurrence number 1 is on the left and the location is monitor. This recalls, but you will still need to enter the values. You can use recall on all of the assessments in this group, making sure that you are making all of the appropriate changes necessary. If the pulse that you need to document is now on the right side, you will need to insert an occurrence, document appropriately, leaving the left pulse occurrence blank. Because the pulse is on the left side and will not be documented, you will need to discontinue this occurrence. In order to do so, click in the pulse rate box under the occurrence you are deleting, then click on Discontinue Occurrence. This will remove that occurrence. Once that occurrence is removed, you will now see that occurrence number 1 is now your right-sided pulse, and occurrence number 2 is gone. Finish documenting all of your vitals on the page, then go to the bottom and click Go To. This will bring you to the 5 assessments again and choose the assessment that you would like to open. Once that assessment is open, please be sure to click on Recall at the bottom before you start documenting. Then continue documenting. The process we just used for inserting and removing occurrences can be followed anywhere an occurrence needs to be inserted or removed. When using Recall, make sure to make all of the appropriate changes to the assessments that have been made. This is especially important in your NIH scale and your neuro exam. You can also do the same process as we were using to document each individual one, except click on the document spreadsheet. Highlight the pre and post to Nectoplace, and then at the bottom, click on Document Spreadsheet. If you choose Document Spreadsheet, all of the required assessments will become open at one time. It will be one long spreadsheet, including all 5 assessments. In this spreadsheet, once a time is documented, you cannot go back and edit any of the date or times. You can only add new. First, click on the last column and click Edit Date and Time and put in the correct date and time according to your stroke tracker. To recall your values, highlight the date and time of the column you want to recall. Remember, if you only added a set of vitals at one time, it will still show up here, so you do not want to recall that column. You want to make sure that you're recalling the last column that had all of the data that was necessary for your 15-minute vitals, for example. So in this case, we're going to click on Sunday 1/29 at 22:37. Highlight that so that it turns green, and then click Copy at the bottom of the screen. Then go to the column that you want the data to go into, in this case Monday 1:30 at 13:26. Highlight it, it will turn green, and then at the bottom click Paste. Update your vitals and the assessments for everything that has changed since your last assessment. Enter new occurrences as needed and delete others as needed, as we did above. Once complete, click Save at the bottom and continue this process until all of your required assessments have been completed. If you have any questions or concerns or ideas on improving stroke care or stroke documentation, please contact your ED manager or stroke coordinator at your site. Thank you for all you do for our stroke patients.